Hi everyone, welcome to this episode of Mary's Health Chat. It is time for some health chat. Let's discuss health. I bring you a very wonderful and sweet topic today. Malaria in pregnancy. What exactly is malaria in pregnancy and how dangerous is malaria in pregnancy? Malaria is very dangerous to a pregnant woman and her fetus in utero, that's her baby in the womb. Malaria causes many adverse conditions like stillbirth, abortion, that's miscarriage, maternal deaths, fetal deaths, premature birth, and a lot, including anemia. So this malaria has a high rank, or is being ranked and been reported to affect more pregnant women than non-pregnant adults. It has an affinity for pregnant women due to how their condition is than a non-pregnant adult. What exactly is this malaria? Malaria can be defined as a life-threatening disease that is caused by a parasite known as Plasmodium. And this Plasmodium is being transmitted by the bite of female Anopheles mosquito. We have different type of Plasmodium or different species of Plasmodium parasites. We have Plasmodium falciparum, we have Plasmodium ovale, Plasmodium vivax, and Plasmodium malariae. Let's go over to knowing the transmission cycle of malaria. That's the life cycle of malaria infection. Okay, it starts when a mosquito bites an infected person, picking up this Plasmodium parasite from the blood of that infected person. Then this malaria goes ahead to bite a non-infected person, transmitting this parasite into their body. This parasite now in their bloodstream swims to the liver. It stays in the liver from 7 to 14 days, and during this state it stays and it matures in the liver. And this particular stage is asymptomatic, meaning that it shows no symptom. So within these 7 to 14 days, the person will not be having any symptom of malaria at all. So after they have matured enough in the liver, they leave the liver and now travels into the bloodstream, targeting the red blood cells. It infects the red blood cells and stays there to grow and multiply. And while it's multiplying, it is destroying the hemoglobin, that's part of the blood that carries oxygen. It's also destroying the proteins in the red blood cells. And finally, this red blood cell now bursts due to the trauma and complications that is harboring. Okay, just imagine how many red blood cells that this malaria parasite will infect. And once it infects the red blood cell, it grows there and it multiplies there. The more the red blood cell, the more it's growing. Okay, so while inside the red blood cell, it also transforms into a sexual stage, which is known as the gametocyte. So in that person's body, when another mosquito now bites the person, it picks this gametocyte, and now the cycle continues again. So this means to say that this parasite Plasmodium has something for the red blood cell. It feeds on the red blood cell. The red blood cell is a favorable condition for it. So once it matures in the liver, it goes straight to attack the red blood cell, feed from the red blood cell, destroy it as well. In this stage now, when it affects the red blood cell, that's when you start seeing signs and symptoms like fever, chills, headache, general body discomfort, fatigue, rapid breathing. Why you are feeling rapid breathing is because it is destroying the hemoglobins that carries oxygen. So that person will be struggling to breathe. That's in the severe case, okay? And every other signs and symptoms. This cycle we keep on going on and on if the preventions are not in place. Malaria in pregnancy. Malaria in pregnancy is a significant, meaning it's an obvious, because recent studies is reporting that over 290 million people are affected with malaria every year, and 400,000 people die from this malaria infection. and from study they have noticed that it's majorly pregnant women. And I'm not saying that non-pregnant adults don't die from it, they also die from it in a severe case, but pregnant women are more vulnerable to malaria in their pregnancy. So let's get to know how this malaria in pregnancy affect the individuals. Factors that increases the risk of malaria in pregnancy include immunological changes in the body of a pregnant woman. You know that during pregnancy the immune system reduces in order to be able to harbor the new thing and then the new baby, the growing fetus in utero. So the immunity will step down so that it will not attack its own body, it will not attack the fetus as an antigen, like an antibody fights against antigen. So the immune system have to step down. So because of this immune system that have stepped down a little, malaria can now increase in their body and actually affect them, both them and their baby in utero. The next point there is increased blood volume. In pregnancy, we know that the blood volume increase in order to supply the baby with enough nutrients and all that. So with the blood volume being high, you know that there will be more red blood cell in the body. So this is what this parasite is looking for, red blood cell to feed from. So this pregnant woman have enough blood and increased blood volume, so they are more vulnerable to malaria infections in that state. The last one is changes in placenta. Because placenta is a place of exchange between the mother and the fetus in utero, there is enough maternal blood in the placenta and also fetal blood. So since this is a place where blood exchange occurs, I'm not saying that the blood of a mother mix with the baby, no, they don't mix, but this is a place where nutrients from the blood of the mother can be transfused into the blood of the fetus. So it's kind of a site where activity that involve blood is. So malaria parasite sees it as a favorable environment to breed, affecting the baby. Just imagine when malaria parasite invade inside the placenta, it will end up destroying the breathing of the baby, destroying activities of the placenta, causing stillbirth, causing miscarriage, causing a lot of things, causing a lot of damage. It might lead to the death of the mother, it might lead to the death of the baby that is inside the womb. It can lead to the reduction in the growth of the baby that is inside the womb. Okay. The next thing we'll talk about are the preventive measures of malaria in pregnancy. Number one thing that a pregnant woman should know is that she should always be using insecticide treated nets, especially in tropical areas where we have high transmission of malaria, where malaria is endemic. She should always use insecticide treated nets. Another thing you will use to prevent this malaria is indoor residue spraying. Always spray some insecticide inside your home to kill these mosquitoes before you go in or before you rest in your home, to avoid the mosquitoes carrying this parasite, biting you and infecting you, because it has a high effect on you as a pregnant woman. The next is intermittent preventive treatment in pregnancy. This means taking anti-malaria drugs at regular intervals during your pregnancy. And another point to prevent this malaria is do not travel to places with high malaria transmission rates. Do not travel to those places for now till you're done with your pregnancy. Okay, so the next point there is environmental sanitation. Very important. If you want to destroy malaria, you have to start with the breeding places of mosquito. I know that the mosquito breeds in stagnant water, dirty refuse that is dumped at a place, and all that. So environmental sanitation is very much important. Keep your surroundings clean. Let everywhere be clean. Let it be that there is no breeding place for mosquito close to your dwelling place. Then the last but not the least is proper refuse disposal. Please dispose your refuse properly, because it can turn into a breeding space for not just mosquito but for any other insects. They can they can infest around that refuse, causing a lot of things, even causing other nuisance. So please dispose your refuse very properly. Okay, going over to the treatment of malaria. The treatment of malaria, you take prescribed drugs, prescribed malaria drugs, and in a severe case you take prescribed malaria injection in order to control the malaria infection in your body. The other things will be mentioned in my description, so do well to read the description as much as you're watching the video. Thank you all for being with me in this video. I remain your nurse Merit. Thank you for being with me. Don't forget to subscribe, don't forget to like, don't forget to comment and share this video to everyone. Let's save life, let's educate people. Okay, don't forget to watch all other videos I've made. Thank you and bye for now. Bye.